When we're talking about episodes of care, when we've had those discussions, it seems like from a payer standpoint, when you're talking about discrete times like pre-op chemotherapy, adjuvant therapy, you can better define what an episode of care means. But when we're in this context today talking about metastatic disease, it seems like it gets a little bit more challenging to define what an episode of care is because it's so variable and there's so many sequential therapies over time.
Yeah, so great point. So that's where the episode may actually end, is when the 4 areas of breast cancer that we're looking at presuppose at the going in, Bill, that it's not diagnosed as stage 4. So it's in our oncology medical home model, we actually made a distinction between advanced cancer, metastatic disease, and less complex disease, and we put some different guardrails around the care management payments. So that was a big distinction we made in the oncology medical home model between non-metastatic, non-advanced cancer and advanced cancer, where in the metastatic space with the medical home, we looked at the oncologist really becoming effectively the primary care doctor for those patients, because that's what you become. I mean, that's where she or he is. Yeah, they might still see their internist for diabetes, but you really take on the mantle of, and your social workers and your psychologists and your nurses and your advanced practice nurses. So we made that differentiation with advanced cancer in our medical home model. For the episodes, the flipping into the unfortunate consequence of metastatic really kind of ends the episode.
Although I will add that in the oncology care model, which does impact 50% of Medicare patients with cancer, their episode of care design did include metastatic patients. And so the episode begins with the initiation of that first chemotherapy or active therapy, chemo, hormonal, immunologic, cell and gene, whatever it may be. And if it's 6 months, that patient is still on that therapy, the new episode goes on and it continues at those 6-month intervals, re-upping as the next episode. So it has been done.
That's similar to what we did with the oncology medical home. The OCM model, different from the OCM, our trigger is just the oncologist saying this is a person with a confirmed diagnosis of cancer, so she would not need to have that first. The chemotherapy wouldn't be the trigger. The trigger would be the diagnosis based on fine needle aspiration, a lung biopsy with bronchoscopy, a breast cancer biopsy or breast biopsy that proves to be cancer. So that's when the trigger would be, and so similar to the OCM, and then similar to the OCM that you mentioned, if the person unfortunately has advanced cancer, then they're in their oncology medical home until they go into hospice or go to another insurance company or pass away.